Good morning, everybody, and welcome board and online viewers to the April 1st, 2026 Board of Health meeting. The board meeting is officially called to order at 8:01. This virtual meeting is being streamed via YouTube, and it will be rebroadcasted later on Facebook. It seems that we don't have a quorum just yet, so we're going to postpone the approval for the minutes from for the March meeting as either for the end of this meeting or next month.
We currently have a quorum there.
Oh, we have a quorum. Thank you so much, Arlana. So we will proceed. The March minutes were distributed to the board for their review prior to the meeting. Please remember that in compliance with the Open Meetings Act and guidelines, every voting person or member must be seen and heard. Are there any discussions or amendments to the minutes?
I move passage.
Thank you very much. Ms. Margulis, do we have a second?
Second.
I'll second.
Thank you so much. All in favor, please raise your hand and say aye.
Aye. Aye.
Aye.
Chair,
Any?
I'm sorry to interrupt, but we do not have a quorum now. For some reason, Dr. Eccles is not on any longer.
Oh, okay. So we will postpone
Dr. Eccles,
this.
is that your number that just came up?
Yeah.
Yeah. Can you hear me? I'm having trouble with my computer. I had to call it.
Yes.
So we can hear you, and we are going to vote for the minutes. So there were not discussions of or amendments. Ms. Margulis moved to approve. Ms. Haskell second. All in favor, please raise your hand and say aye, so we can hear you, Dr. Eccles. Aye?
Aye.
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 Any opposed, please raise your hand. Any abstentions? And if not, motion approved as distributed. Thank you very much. We're gonna go to the next section. Let's talk about April observances. Child Abuse Prevention Month is April, and I wanted to talk about this because we need to support parents and caregivers in prevention and promoting the creation of safe environment for children, safe from abuse and neglect. And the Face It movement, it's a very important organization in our Commonwealth, shared that in their latest National Child Maltreatment Report shows that while there has been a 13% reduction in child victims of maltreatment from 2020 to 2024, unfortunately, Kentucky continues to see nearly double the national rate, 7.2 per 1,000 of child maltreatment at 14.1 per 1,000 children. Young children remain the most vulnerable as victims of abuse of neglect in the Commonwealth, with 30% of total victims under the age of 4. So let's remember that protecting the children is an adult responsibility in which everyone can play a role. This month is also Parkinson's Awareness Month for highlighting prevention and screening, often represented by blue ribbons. It's also the Autism Acceptance Month that promotes inclusion, belonging, and respect for autistic individuals. And it shifts from awareness to acceptance, reflecting neurodiversity-centered approach that values different ways of thinking and communicating. Also, in April, we will have the National Public Health Week from April 6th to 12th. Let's keep in mind how much the public health has improved our daily lives, safeguarded our families, and expanded our lifespans, and strengthened our communities. And also, let's keep in mind Earth Day is celebrated this month, along with two very important religious celebrations around the world. We will have the opportunity to have two speakers today, but we're going to proceed with the perspective session for this month. It's called Congenital, Syphilis, and the Louisville Metro Public Health and Wellness Strategic Plan. The presenter is Dr. Chris Bryant. Dr. Chris Bryant is MD, is the Associate Medical Director at Louisville Metro Public Health and Wellness, is the hospital epidemiologist at Norton Children's Hospital, medical director for System Pediatric Epidemiology and Infectious Diseases for the Norton's Children's Medical Group here in Louisville, and is also professor of pediatrics at the University of Louisville School of Medicine. Today I present to you Dr. Chris Bryant. Welcome, Dr. Bryant. If you have presentation or if Catalina can assist you, I yield the floor to you. Welcome.
Thank you so much, Dr. Batista Severa, and good morning, everyone. Catalina, are you able to share my slides? Thanks very much. Are you able to display them in presentation mode? Perfect. All right. Well, good morning, everybody. It is an honor to be here to talk to you today about a piece of LMPHW's strategic plan. Next slide, please. As you've no doubt heard previously from Connie, we have a very ambitious and comprehensive strategic plan. I want to spend a few minutes this morning talking to you about strategic plan goal 1. It's bold. We want to eliminate congenital syphilis so that no baby is born with syphilis. Next slide, please. Essentially, we want no more of this. So congenital syphilis causes significant morbidity in infants. It can cause prematurity, low birth weight, birth defects. You see images on the slide of a baby who's jaundiced, small for gestational age, big liver and spleen, has the characteristic skin rash, snuffles. This causes bone defects, but it can also cause miscarriage, child death, blindness, deafness, neurodevelopmental disability. This is what we want to prevent. No baby born with this. Next slide, please. All right. Unfortunately, syphilis cases have been increasing in the U.S. year over year. This was from a Vital Signs CDC report from 2023. It described a massive increase between 2012 and 2022. In 2024, congenital syphilis cases were again higher than they had been. We exceeded 4,000 cases of congenital syphilis across the U.S. in 2024. And that is more than a 700% increase since the early 2000s. Now, if we look nationally, 9 out of 10 cases were preventable, either with timely diagnosis or timely treatment. So we can reduce this number by working together. Next slide, please. All right, so over the next few slides, I want to talk to you about our objectives to achieve our bold goal of eliminating congenital syphilis. By December 31st, 2026, we want to establish a congenital syphilis surveillance system using data from KDPH and other local healthcare partners. We want to use data to guide and strengthen our prevention efforts. By the end of March 2027, we will have developed our work plan to reduce congenital syphilis cases by strengthening partnerships with medical providers, as well as social services providers. We want to establish a congenital syphilis case review board, expand testing capacity. We talked a little bit about point of care testing last month, and enhance linkage to treatment. And then objective number 3 is focused on a comprehensive health education work plan that will involve internal and external stakeholders. Now we're going to delve into these a little bit in more detail. Next slide, please. All right. Objective number 1, you might say, Chris, why don't we already have this? Congenital syphilis is a reportable disease. So what's the deal with data? If you ask me today about all of the cases of pertussis in Jefferson County, I would simply work with our CD team. We would go into NEDS, we would run a report, and I could tell you how many, what their ages are, where they lived, who they, everything about them. Syphilis and other sexually transmitted diseases are different. They are not reported to us at LMPHW. They are reported to the state, and the state needs to give us data back. We don't really have data in real time. The data goes through a pretty extensive review process. It's verified with CDC. And so there is a delay. It is not real time. And when we need data, we make a request to our partners at the state. Next paragraph. Next slide, please. I did make a request to the state. Now, I will share that these are confidential and provisional. They are not for publication. But I did feel like the board needed to understand the numbers for the last 3 years. This is the information shared by KDPH. If you just take a look at these, you can see that on the bright side, the number of cases is decreasing. That 2025 number is still provisional. About 30% of our moms who have syphilis end up delivering a baby with congenital syphilis. This is a missed opportunity for prevention. Bright side, down from 65%. You can see some basic demographics. You can also missed opportunities for prevention. So, Dr. Burns, you might not be muted. So I'll give you just a minute to look at and let's go to the next slide, because I would love to pause and have a discussion. What else would you like to know about cases of congenital syphilis in Metro Louisville? What data do you think will help us drive our prevention efforts? Anybody have thoughts about that?
Can you hear me?
Yes, Dr. Burns, we can.
Okay. No, I'm sorry. I had just joined in. I do apologize. I had a emergency I had to take care of. No, but from what you're presenting, I mean, everything seems okay to me. I guess my big thing is this: a lot of patients, a lot of these patients will have positive syphilis TP tests. We just need to make sure that whoever's ordering, that the labs know to reflex over to the RPRs, to let us know who's acutely infected and who's not.
Yeah, thanks, Dr. Burns. So recognizing that there is.
Excuse me, what is RPR?
Yeah. So I thought I might give Dr. Burns, you want to explain, or you want me to?
Oh, no. You go right ahead. That's fine.
Yeah, okay. Just tell me what RPR, what the words are.
Yeah, it stands for rapid plasma reagent, but
Thank you.
thought it might be good, since we have a variety of broad spectrum of expertise on the board. Dr. Burns mentioned the TPA. So typically what's done for syphilis screening currently is what's called the reverse algorithm. The first test is often an antibody test, that's the TPA. And if you've ever been infected with syphilis, you will have a positive antibody test. That's just the immune system remembering that you've been infected with syphilis. To know whether you have active syphilis, you need to do the RPR test. And that is actually a titer And using those two pieces of information, we can understand if someone is actively infected. So, to Dr. Burns' point, all cases of congenital syphilis, or all cases of syphilis in pregnant people, are tracked by the state. And so I feel good about the counting, that we're not counting people who don't have active syphilis. I would like to see a lot more data. You don't see ethnicity here. You don't see language. Syphilis is a syndemic. And so it tracks along with drug use, poverty, homelessness. And so I would love to see more. So if you think of data points you'd like, please put them in the chat. Let's go to we've got the next slide. So let's go back to that one, Catalina. All right, so this is objective number 2. In the future, we'll show you a beautiful key driver diagram about all the things we're going to do to get to this objective, but we're still in the process of building that. I want to highlight 3 opportunities here for objective 1.2. We really want to improve testing during pregnancy according to KDPH and ACOG recommendations. A congenital syphilis review board is an evidence-based intervention used in other states and communities. We don't have one in Kentucky. And we want to remove barriers to treatment. Next slide, please. Several years ago, the Kentucky Department for Public Health released this health alert, noting cases of congenital syphilis were rising and recommending that pregnant individuals be tested 3 times during pregnancy. Coincident with this, the health department reached out to each of the major healthcare systems in Louisville, as well as family health centers, to discuss the recommendations and make sure that these would be implemented. We did receive an agreement from all of the health systems that they would do this, or they were already doing it. I think one of our challenges is we don't know if this is actually happening. And as you look at the data, you look at the number of moms who were not tested at their first prenatal visit, that does suggest there is room for improved reliability with these recommendations. Next slide, please. Again, we just don't know how many pregnant individuals are getting screened 3 times. A congenital syphilis review board is a multidisciplinary group that in other states does not just include public health professionals. It includes pediatricians, neonatologists, obstetricians, others from the community who have a stake in preventing congenital syphilis. This has been initiated in other communities and states. Louisiana has one of the highest rates historically of congenital syphilis in the US. They instituted their congenital review board in 2016. And on the slide, you see some data from their first year or so of congenital review board discussions. They review each case, they identify missed opportunities, and then they act on those missed opportunities. They have a team that reaches out to providers to say, all right, you didn't screen. What are your barriers? How can we help? A mom was in treatment, but missed a bunch of appointments and didn't end up completing treatment. What resources do we have to bring to reduce that? So I was able to attend a congenital review board in Columbus, Ohio, learn a bit more about the process. We did petition the Kentucky Department for Public Health to institute a congenital syphilis review board, and I am happy to report that the first one is scheduled for the 3rd week in April. So hopefully I'll be able to update you that's a win about that at a future meeting. Next slide, please. All right. My third bullet point for you was reducing barriers to syphilis treatment. NACCHO has a really nice web page where other states and jurisdictions have shared what they have done to reduce congenital syphilis. And I've just highlighted a few of them on this slide. Oregon, for instance, offers non-cash incentives for engaging in medical care and adherence to syphilis treatment regimens. We don't do that in Louisville, but what we have done is when women are receiving treatment at the specialty clinic, we have instituted a new process to connect them to Healthy Babies Louisville and all of the resources that live within Healthy Babies Louisville. Granny's Birth Initiative, for instance, can provide free transportation. There are mother-child pantries where you can get baby supplies, other things that moms and families need. Louisiana offers home treatment for pregnant individuals and partners. Well, that's a game changer. We're not at the home treatment phase yet, but I want to give a shout out to Liz Triplett Thieneman and Humberto Lopez at the specialty clinic. We had a mom with syphilis, pregnant mom, who was really struggling to get to her appointments. They actually took a dose of penicillin to her treatment facility so that she could complete her treatment in a timely fashion. So another win, and we'll do more brainstorming about that as we go on. Next slide, please. All right, objective number 3 is really about a comprehensive education plan. By enhancing education, we hope to reduce stigma and increase testing and treatment, not only of pregnant people, but of people of childbearing age. And if we go to the next slide, you'll see some data from CDC that shows that we have increased rates of syphilis in women of childbearing age. These are some of the people that we want to get to, right? We want to diagnose and treat their syphilis before they become pregnant. I personally think we don't just need to focus on women, we need to focus on men and women. I'm just sharing the CDC data though. Next slide, please. All right, so over the next few months, we'll be working on our education strategy. We want to make sure that whenever individuals contact us at the health department through our clinical services, through harm reduction, we offer syphilis education. A reach goal might be syphilis testing. We have a beginning collaboration with Healthy Babies Louisville. But we are looking for other partners. So who else? So I think we are almost at the end of the slides. Let's go to the next one. How can you contribute to these objectives? I think we would love to know how the Board of Health would like to partner with LMPHW to achieve these objectives. What ideas do you have for how we can be successful?
Is it possible for someone to say, right, we didn't start with the OBs originally? Is that a place that we can look at potentially and start there and say, hey, what is the percentage that actually folks are getting checked, right? What number? Because I think we can sort of partner up that way as well, especially with the large healthcare firms and hospitals in the community. I think it's going to take a community effort and not just one dashboard or one source of data.
Yes, completely agree with you. And partnership with obstetrical colleagues will be really important.
So, Dr. Bryant, there's a comment in the chat from Deputy Mayor George that said, what specifically needs to happen to expand surveillance and enhance data sharing?
That's a great question, and maybe one that we could continue to talk about offline. We are working closely with KDPH and partners there on data sharing. I think the Congenital Syphilis Review Board is a step in the right direction because we'll be able to do a deep dive into each case. We'll be able to understand where the missed opportunities are. As part of that, I'm hoping we can be very granular. So, if a woman presented to care at an ICC and that was an opportunity to treat that wasn't capitalized on, well, then we work with that health system, that ICC. I think that's the first step. I will, and I'll just say we're having ongoing discussions to how to facilitate this information sharing. With really not to have the data just to have the data, but to drive action.
It would also be interesting to see where the first pregnancy test turns positive. Because I think if we can get folks there, right, whether it's the ER, the family care, the OB, I think that's how folks are sort of seeking care. And I think targeting those areas to say, hey, look, maybe even from an education standpoint, right, to say, hey, this is when you should be tested for syphilis, or if you don't, these are the implications, right? And it's one thing just to put a flyer out, but it's another thing if it's front and center and somebody's talking about it, that somebody would be more likely to seek care, to get care, and then also discuss sort of the partner treatment, right? I mean, we do that in the ED all the time when we diagnose other STIs.
Yeah, thank you for that.
Kristina, I appreciate the very good presentation. Have you all taken any steps to publicize this, i.e. go on TV? I am not daily involved with public health, and the increases in this are dramatic, and I really did not realize that the situation had increased like it had, and I looked at the numbers and they're fairly small, but even a single increase or a single infected child is too many. But again, I don't think this is something that is realized by the general public.
Yeah, thank you. It's a great point. So when KDPH released their health alert about testing, we had a big media push, and we have not had anything recently. Okay. Also coincident with that, we had some social media messaging really targeted at people of childbearing age. It's a great suggestion. One of our challenges, I showed you those data. I am prohibited really from sharing those publicly at this point in time because they're not finalized. So we have to think about the messaging.
Okay.
I think the idea of having a review board is very promising. And you highlighted there's no involvement from public health, and it should be. So I would just advocate for somebody from public health to be involved into this, and somebody, big in communications as well. And public health, Louisville Metropolitan Health and Wellness is good at that. But the multi-pronged approach to this awareness, strengthening partnerships and working as a team, I think it's the best approach. Thank you very much, Dr. Bryant. Anybody else?
Excellent presentation, Dr. Bryant. I really appreciate all the information. Thank you so much.
Thank you, Dr. Burns. And thank you to all. Thank you to everyone for your thoughts and suggestions today. If you have time, I've included 2 websites in the slides that that really outline some of the terrific work that is happening in other communities. Anybody who has time to peruse those and you think, we could do this here, we could do it better here, that would be great. And so much the better if you say, we should do this and I want to help.
Thank you. And that's the whole purpose for Dr. Bryant's presentation, to bring awareness to the Board of Health and through the Board of Health to the different organizations that we represent and that we bring to the table. So please, Arlana, if we could share Dr. Bryant's website so everybody can have access to them. And then after reviewing, let's try to find work that we can be involved in as a Board of Health, or try to do our best supporting the strategic plan. Thank you so much, Dr. Bryant. Appreciate it. Anybody else? And if not, thank you so much. If not, we're going to go to our second speaker. And again, it's trying to highlight the importance of the strategic plan that the Metropolitan Health and Wellness has, and giving us as a Board of Health and as a community, Jefferson County community, the opportunity to see what we can do to get involved in this. Now we will have Dr. Stephanie Lockett. She's the Director of Clinical Services, the Louisville Metro Department for Public Health and Wellness, and she will talk to us about immunization strategic plan update. So as well, just like Dr. Bryant did, talking about goals and objectives, we will get the information from Dr. Lockett. Dr. Lockett, if you have your presentation ready, I yield the floor to you. Thank you very much.
Thank you. Catalina, do you have my presentation, or would you like me to share it? Perfect. So basically today we're just going to get a little bit of an update on our strategic plan as it relates to immunizations. If we could get the next slide, please. So the third goal in our strategic plan does focus on immunization, and within that goal being that 90% of kindergarten students will be up to date on their routine vaccinations. 90% of 7th and 11th grade students will be up to date, and that 50% of children will receive an annual flu vaccination. Next slide, please. The objectives within that goal, by December of this year and annually thereafter, we would like to conduct 4 promotional campaigns to expand immunization outreach, decrease vaccine hesitancy, and increase vaccination among populations of focus. By December of 2027, LMPHW will increase collaboration with JCPS and various community partners to assess key barriers to compliance and implement tailored strategies for low compliance schools by identifying schools with the greatest disparities in immunization compliance among those target groups of kindergarten, 7th grade, and 11th grade students. And then by June of 2027, LMPHW will engage with existing vaccine coalitions to collaboratively set shared immunization objectives to improve vaccine compliance among school-aged children by identifying and aligning community resources and supports. Next slide, please. So when we talk about vaccination, what does up-to-date mean? I'm not going to belabor this by reading all of this to you, but essentially for kindergartners, we have the routine vaccines that are required for school attendance. And we can go to the next slide. So this is 7th grade vaccines. You see the addition there of the meningococcal vaccine. And then for 11th grade on the next slide. And again, these are just the vaccines that are required to be up to date. And you will get these slides so you can take a look at those in more detail if you would like. Next slide, please. So where are we right now? This comes from KDPH data, which is reported to the state by the school system. As you can see, over the past several years, we have not obviously met the 90% goal that we have set for our strategic plan. Our lowest levels of vaccine compliance being at that 11th grade level. But we are, this past year, 71.9% of students in the 7th grade had achieved full compliance, 58.4 at the kindergarten level, and 37.2 at the 11th grade level. So we certainly have some work to do within our community to get our pediatric populations up to date with their vaccinations. Next slide, please. So I've included a link here, and when you get a copy of the slides, I encourage you to click on it. Every year, JCPS has to report to the state their vaccination rates, and there's a really cool dashboard that's maintained by KDPH, and you can actually see school by school what the vaccination rate is for that particular school. So I would like to challenge all of you to go in, take a look at that dashboard, and if there's a school that you have influence with or involvement with, take a look at what those rates are and see if you can be a vaccine champion within, that school, or provide any encouragement, or just kind of see what's going on at the different schools. Next slide, please. So how do we plan to meet our objectives? Our first objective, as I talked about, was conducting those promotional campaigns. Obviously, we have a rockstar communications department at LMPHW, and so definitely maintaining a social media presence around immunization. We do that specific to certain times of the year, like the flu vaccine, but also just throughout the year as we talk about back to school. Being able to maintain that social media presence there. And then we would like to work on some outreach directly through JCPS, if that is flyers, handouts, etc. That will help us to meet that objective as well. Next slide, please. For our second objective, try to increase that collaboration with JCPS and community partners and identify those barriers. Annually, we review the data that's submitted by JCPS. We would also like to work with our population health team to determine if additional surveys to parents or guardians may be of benefit. And then creating target strategies based on needs identified, using that data, like what schools are most have the lowest compliance rates, or identifying the different target areas. And next slide. And then the last goal is engaging with those, the last objective is engaging with those vaccine coalitions. We will connect with the Immunize Kentucky Coalition, and also the Louisville Immunization Coalition to help create data and increase awareness. Additionally, partnering with organizations to share our educational materials, event dates and times, and important developments in vaccine. And then collaborate through those vaccine coalitions to conduct school and community vaccine events. Next slide. So what are we doing currently? I know Dr. Bryant had the opportunity to share a couple of wins. I want to share a big win that we have funding and have ordered a mobile immunization unit. So this will be a unit that is set up and customized to maintain vaccine temperatures for both refrigerated and frozen vaccines. It's something that anybody can drive. It doesn't require a special driver. We'll just be able to, hop in the vehicle, take it out, and have community events. And it'll be much easier to maintain vaccine supply at proper temperatures. And it's just super exciting to have this ability. We have ordered it. It takes a little while to get customized, but I am very hopeful that sometime this year we will have that unit ready to go. Also, coordination with community partners. We have had several vaccine events. Our immunization team has made great strides in connecting with community partners, going out and providing vaccine at multiple places. We have a continued partnership with JCPS for receiving data, and hope to increase our involvement with potential vaccine administration partnerships. And then we are, as I said, doing those educational campaigns around specific vaccine.
can I ask a question here, please? This is Heidi.
Yeah.
And thank you to everyone at LMPHW, because this is an important priority of mine. Over the years, there has been a deficiency, very low scores in the southeastern or southwestern part of our community, and largely due to politics as well, and having the right influencers. We used in the past the PRP fire department because our fire district extremely influential in that community. And I don't know if we currently have coordination still with them, but I would surmise that if you took a look at the data, that that it would show that. But so I guess my question is, where has this unit gone, and is that part are those zip codes priority for it?
So the unit will go anywhere in the city, and I definitely think that one of the things that I'm gonna kind of give some recommendation for what folks can do to assist with the immunization campaigns. And one of those things is helping us to identify those partners.
Well, just go get them. All I'm saying is go get them.
Okay.
Because that's where at least, and you should look at more current data because I don't have access to that anymore. I have access probably through the university since I'm on their operating board. But please, just outreach, go there, meet with them, whatever it takes. And thank you.
Thank you, Heidi. Can we get the next slide? So basically, what does LMPHW need from you as a Board of Health? So obviously recommendations of partners to reach those populations most at risk. And we do, consistent with what Heidi was mentioning, that, the southern and western parts of the city are definitely more lacking in vaccines in places that we need to outreach more than other areas of the city. We need continued advocacy for vaccines at all levels, whether it's in your local community, at the state and federal level. Obviously, there are conversations around vaccines and immunization requirements, and we really need advocacy from the board supporting, vaccination as that is one of the major public health initiatives, one of the most successful public health initiatives that we have, and we need advocacy at all levels. We would like for you as board members to be sharing events or education materials on social media or your other outlets. And then advocating for legislation that supports vaccination and vaccine requirements. Obviously, a hot topic at multiple levels. Could you try? Next slide, please. And that's it. So obviously, immunization is a priority for LMPHW. It's a priority for JCPS. There is so much work that goes into immunizations across the board. And we need you as a Board of Health to be advocates, to be reaching out and saying, hey, I know this place and it would be great for you to bring your mobile unit here and give vaccines. Just in general conversation, vaccines are safe. Vaccines are beneficial. Vaccines cause adults, right? That's one of my favorite quotes. So definitely appreciate all that you do as a Board of Health, and would appreciate you continuing to be advocates for vaccination in the community and helping us to meet these objectives.
Thank you very much, Dr. Lockett. Do we have any questions or comments for her? And if not, I will be continue doing the advocacy and the videos and promoting immunizations along with the Immunizations Advocacy Committee from the Board of Health, along with Dr. Anna Wang. Thank you so much. Appreciate it.
Thank you.
So we will continue our agenda and allow time and space for updates and reports. I yield the floor to Deputy Mayor Nicole George.
I think Deputy Mayor George had to leave a few minutes early for budget meetings. Oh, you're muted. Sorry.
I'm sorry. Thank you so much. Just in time. Now I yield the floor to Louisville Metro Public Health and Wellness Chief Health Strategist, Ms. Connie Mendel.
Thank you. And I want to absolutely thank the presenters. With Dr. Lockett and Dr. Bryant, along with Stacy Ingram, this is our Health Services Division dream team. I am just thrilled and honored to be able to work with these fantastic experts in their field. Thank you, and thank you for the presentations. Everyone should have a copy of the director's report, and I will just quickly go over a couple of highlights. One of those being is last week we announced the beginning, or the renewed effort, I should say, in massage facilities inspections and enforcement, trying to ensure that they meet the state requirement of having a licensed massage therapist on site, but most importantly and specifically, the work is to reduce human trafficking. So we know that a lot of these massage, or some, I shouldn't say a lot, there are massage facilities that are fronts as illegal operations that of human trafficking. So this is certainly a concern. These illicit operators disguise themselves as legitimate businesses, and basically they prey on people. And also, these are businesses that we do not want in our community. So working in a partnership with ABCs, which handles special licensing, LMPD, and human trafficking networks, we have revised an old ordinance that was on the books, and will be doing even more enforcement toward these facilities, and really looking to close those businesses that are illicit and obviously with a goal of decreasing human trafficking in our community. So the opportunity, if you suspect such a business is going on, please report that to Metro Call 311 or 574-5000. So there's more information in your booklet. Unfortunately, I have some sad news to share that we did experience a fire at our Newburgh WIC location. So that was a label printer is the likely culprit that was on a desk with a short, and did considerable damage to that office, and then water smoke damage throughout the WIC clinic. So that Newburgh location is temporarily closed. We're providing services at LNN and other areas, and then resorting to some of our telemedicine options, but it will likely be 3 months before they're up and running. We're looking to find an alternative location within that Newburgh area to serve those clients that, many of which have transportation needs. So as I said, if we're working to identify that. If you have a suggestion and you know of space where we could staff, please let me know. The sooner the better. But all of our clients are being served just in an alternative fashion. And we're also, we still continue to operate at our Dixie location at LNN, which is on West Broadway, and then the Fairdale Neighborhood Place. And the last thing I'll touch on is that it's spring, yay. But that also means reemergence of mosquitoes and ticks. So we have a great Spot a Tick program. There's information in the bulletin. we're hugely fortunate to have our own public health laboratory, which is not the norm for local health departments. So, and part of what our laboratory does for us is offer testing of mosquitoes and ticks. So we're looking for those mosquito-borne diseases like West Nile, and tick-borne like Lyme and ehrlichiosis and, Rocky Spotted Mountain Fever. Did I get that out of order? So that information is there. Please share as you enjoy our parks and other areas within Metro Louisville. If you have a tick, save that for us, and we'll get that identified. Yes, Heidi.
How many? I'm going back to the massage deal, which repulses me. If I might share that clinical personal observation. How many facilities are there? This is not unlike when we went after the rental and paint and all the rest of what you and I have been through. How many of them are there, and what's it going to take to get them all licensed? Because it's a horrible thought to me.
Yeah. So as far as legitimate massage businesses or any of those calling themselves, so that includes legitimate and illicit, they're likely 300 to 400. Now, some are independent massage therapists, and those are not included in the ordinance if you're not working under a business. If you're just working independently under your license, you're a licensed massage therapist from the state. If you're working under that, but we
I'm talking about the ones who aren't licensed.
Yeah. Well, yeah, they're all now just beginning to get licensed, so it's really a process of us inspecting. So what our team has done a lot of internet search, and so we've identified somewhere between upwards over 300 total in the community, maybe likely more. So again, we're scattering social media and internet, and we've identified a list, and so basically there's now an application period. So there are 60 days. So they have until June the 1st for all businesses to apply for their license. And then we've already begun the inspections and what our inspectors are, they're trained to look for signs of human trafficking.
Okay, and in your report monthly, if you wouldn't mind doing a chart that shows a comparison over time. In other words, what was it at the outset? What is the current? And what is the goal percentage? And do it red, yellow, green.
Sure, we can put something together like that.
Yes, and let's send that out prior to each meeting so that we know in your wonderful report.
Okay. Yes. Okay.
Thank you.
Thank you very much, Chief Health Strategist. Appreciate it. And we go
Dr. Eccles has her hand up.
Oh, I didn't see that. Go ahead, Dr. Eccles.
Okay. If it's a question for me, Dr. Eccles, you can always reach out to me directly.
Or you can write it on the chat, and we can read it to Ms.
Can you all not hear me? I'm so sorry.
Yes, now, yes. Now
I'm having a lot of technical difficulties today. I apologize. Going back to the WIC clinic in Newburgh, is the community center not an option? I don't know. I mean, they essentially share, property.
Yeah, unfortunately, with the fire, that there was some smoke damage in the community center also, and the pantry and the LIHEAP offices. So those are all closed temporarily, although the community center should be opening in the next few weeks. It was they didn't get the water damage and fire damage that the WIC clinic did.
Okay, I will reach out offline because I do have some contacts in the community, and hopefully we can find you a space because it's so vital to Newburgh. That's like such a big hub where families and kids and so many people in the community can really get a lot of resources at once. So we will have to definitely find some space for you all, and thank you so much for sharing that.
Thank you. We appreciate that.
Thank you so much, Dr. Eccles. Thank you, Ms. Mendel. Anybody else with questions or comments for her? And if not, we will continue with our agenda. Now I yield the floor to Dr. Bart Irwin from Family Health Centers. Dr. Irwin.
Yeah, thank you. As announced by the mayor yesterday at a press conference, Family Health Centers has entered into a partnership with Metro Louisville, the Jewish Heritage Foundation, or fund, and also Jefferson County Public Schools to open 2 more school-based health centers within the next year or so. It's astounding to realize that on any given school day that about 14% of the population of Jefferson County is in a Jefferson County public school facility. So it makes sense to put needed services like healthcare within reach of these individuals. So currently, Family Health Centers operates the Iroquois Health Center, school-based health center. We've done that for about a year and a half. We've served 1,800 patients for about 6,000 visits. And that includes not only students, but staff there and some parents as well. So over the next year, we'll establish school-based health center at Pleasure Ridge Park and Marion Seymour schools. And we're currently in the process of working with those schools to identify a space within the building where we could have an adequate space for a health center. So happy to announce that.
These are great news. Thank you very much. Thank you very much, Dr. Irwin. For healthcare coverage and outreach, now I yield the floor to Ms. Ashley Shoemaker. Ms. Shoemaker.
Yes, so the coalition met on February 9th. A major topic of discussion was child renewals. Since child renewals began last July, in Jefferson County, approximately 10,000 children have lost Medicaid coverage. This represents a 5.6% decrease in child Medicaid numbers. What we're seeing is that the vast majority of terminations are for procedural reasons, meaning families are not submitting the paperwork and completing the renewals. In February, 74% of all children who lost Medicaid was for procedural reasons. So the coalition has been trying to reach out to families and educate them on the importance of completing those renewals and submitting the paperwork, explaining that the income guidelines for children are higher than they are for adults. So families should not just assume that they don't qualify anymore, if their income has increased, because those income guidelines are much higher for children than they are for adults. The other main topic of conversation, and I do have an update, a very current update, is House Bill 2. I've discussed this in previous meetings, but this is the Medicaid reform bill that is largely aligning state policy with the federal guidelines set in HR 1 that passed last year. The Senate is set to vote on their committee substitute to this bill today. The Senate's version does walk back some of the more burdensome parts of what the House had passed, including reducing copays from $20 for most services to $5. And aligning the implementation with the federal start date of January 1st of 2027. It also changes the work reporting requirement when a Medicaid member renews their coverage from having to verify that they met the work reporting requirement in 3 consecutive of the last 6 months to any 3 of the last 6 months. Federal policy only requires 1 month, so it does still go further than what the federal law requires, but it's not quite as burdensome as what the House passed. So the House will also, assuming it passes the Senate, which I have every reason to believe it will pass today, the House will also need to vote on these changes today to avoid the risk of a governor's veto. So we will see what happens today, but I do have every reason to believe that this will pass and become law. But the good news is that it did remove some of those, especially troublesome or concerning parts of the bill. Our next coalition meeting is scheduled for April 13th at 4 o'clock. Does anyone have any questions for me?
No, just a comment. Thank you for sharing the removal of those ugly parts of that bill. And it's a relief to know this. Thank you so much. There is no updates from the Immunizations Advocacy Committee. Now we got to our Community Advisory Board for JCPS Health. I yield the floor to Dr. Eva Stone. Dr. Stone.
Can you hear me? My microphone didn't want to come off mute. My video doesn't want to work, so it's going to be one of those days, isn't it? So I want to start by just speaking a little bit more to immunizations, because I think it's important to know where we were and where we've come when we have this discussion. In 2022, so right after the pandemic, JCPS, because we had identified issues within the district for vaccine information on students, we became VFC providers so that we and our school team could begin administering vaccines. Since that time, 1,000 vaccinations to over 5,800 kids. And so there has been an immense amount of work happening. But so we've become VFC providers, we've held mass clinics, we've continued to hold school-based clinics, we cycle around the districts. We have 4 sites within the districts that are VFC locations that our nurses can pull from, and organizations as well. We opened 2 standalone clinics where families can bring their kids for vaccines. We have instituted an electronic health record, and we've been able to interface that EHR with Kentucky Immunization Registry because one of the huge issues for us was getting student vaccination records, which presents a picture that may not be accurate. So we're now interfaced with KYIR, so we get an automatic upload of records once a month. And we now have bidirectional exchange so that if we have parental consent, we can push those vaccines back to the registry, which helps with continuity of care across all healthcare systems. We had KYIR team, immunization registry team out, and they were just going to audit a few schools. I asked them to audit schools for each of our zone leads so that we could look at the records, we could make sure the data is correct and make sure things are transferring like they should, which was also very helpful. The folks from KYIR told us that historic KYIR data hasn't been great in Louisville because a lot of providers weren't consistently using the system. And so I say all that to say, we need help. We need all hands on deck. We have 162 schools, and we're incredibly excited and happy that we're going to open 2 more school beds. But we have 162 schools, and we have a lot of healthcare needs across the district. You've heard what's happening with Medicaid, and so kids are unenrolling. Families are choosing not to re-enroll in Medicaid. There's a lot of anxiety for our international families when they don't have health insurance. That creates an additional barrier to getting. Really fortunate that our board and administration has continued to support us being able to provide these services in the schools. But our greatest needs are, number 1, helping get shots in arms. But number 2, it's working with providers because we're the school system. And although we have a regulation that kids are supposed to have vaccines to come to school, it's really the healthcare community that should have their arms around this happening. And so I would urge you all, schools directly, we've got people in place who are doing that work. We don't need to add more burden. Let us do what we're doing, but please look and see what the healthcare community is doing. Who's using KYIR? Who's not using KYIR? How can we work with providers to make sure that, in particular, kids that have Medicaid, we have providers that will do their preventive health exams, but tell them to get where. That's less of an issue that it used to be, but it's still an ongoing. Deputy Mayor George mentioned data and how we need to use our data to drive our action, and I would urge the same thing in this regard. We know what the data is telling us. We're working to develop systems to get to those kids, but we need all of Louisville to acknowledge that this is an issue, and let's all figure out how we can get our arms wrapped around kids and get them vaccinated. Kids, I use our immunization data to tell me about access to healthcare, which we have also talked about here. Have some areas that there's less of an access to healthcare than maybe we would like to see. And so how can care systems to use their community health dollars to help work and address these gaps in care and services that we've got for so many kids. To give that sort of as an update, you've heard lots in the news about budget cuts coming to JCPS. We are losing some of our epidemiologists. We're losing 4 nurse practitioners, which is going to hurt. I'm told and have been assured that we will still have our model to have nurses in every school. And so we're moving forward, with the understanding that that's what's going to happen next year, but we will have to be making some adjustments to the way we are delivering services, but we plan to carry on. We will be doing our summer clinics. We will be continue to offer employee health services. We offer free physicals for any new employee coming into JCPS because we want to facilitate the onboarding, and there's quite a cost to people who are starting a new preventive services done. So we offer those at no cost. And now we're expanding. Many of our nurse practitioners have to do the DOT examinations. Our work in that is to try to help facilitate onboarding of school bus drivers. But the other hope that I have is that by doing it internally, that we're able to build some relationships with some of our drivers. I've just experienced this in other districts where I worked. I did the DOT exams, and what I got to do was learn the drivers, know the drivers, and then help work on some health together. And so, that's the outcome that I hope to see here in JCPS. Other than that, we are staying the course. Spring we don't have that many weeks of school left for this school year, believe it or not. And so we will revamp and revise once all the dust with all the incredible volume of changes that are coming right now, and we'll be back at it for next school year. And I'm happy to take any questions.
Thank you, Dr. Stone. I just second the comment that Dr. Lockett wrote on the chat. You definitely are a champion for immunizations, for the county, for the Commonwealth, for the country. Thank you so much for the great effort. And a question comes to mind: who can do the checking on who is doing and following Kentucky Immunization Registry within the county? Is it Louisville Metro Public Health and Wellness, or is it Kentucky Department of Public Health? Who does that? And if somebody does it, is there a way to enforce the registration? I think the question is either for you, Dr. Stone, or for Ms. Mendel.
Connie, you may know better than me because I don't know what the health department has access to do within the registry. For us, it is just when we look kids up, and their vaccines aren't in the registry, or when our nursing teams look them up, no vaccines are in the registry. And then they have to hunt down who that provider is, and then go directly try to reach out to the providers to get records because they're not in KYR. We can certainly start keeping track of that if there's not a way to know within the city who's doing it and who's not.
Yeah. And I mean, I do know that it's not a requirement to report to KYIR, and Dr. Lockett will correct me, or Dr. Bryant, although, you know, we encourage everyone to do so. And it really, sometimes it may depend on the EHR system at the practice, and some of them are, you know, connected directly, like yours and ours, where others, it would be a dual entry. So, and then I'll pass it off to Dr. Lockett or Dr. Bryant.
I think this might be an area which needs more investigation. It is not required. We can't compel people to put their immunizations in. If providers have an EHR that doesn't connect well, or you know, in the past, people didn't have EHR. It was very laborious to put it in. I am struck, though, that most pediatric providers in the community have an EHR that connects, and historical information is being shared with KYIR. That was something that happened maybe a year and a half ago, at least in the Norton system. And so we may want to explore where the gaps are. I have had conversations with Jessica Beal at Molina. It does seem that from her perspective, the last time we talked, I understood that there was not universal, but good use of the KYIR.
Mm-hmm. I think we'll see what we'll see with this year's immunization survey. You know, we still have schools that are struggling, but the struggling, again, until we know where the real issues are. Is it a question of records? Is it my folks doing their due diligence to try and hunt down records? And you all can imagine, I mean, I'm not just anything we can do to facilitate a system between entities that enhances or supports this work. Because, you know, I was at a school yesterday, that school nurse is seeing 600 kids a month. I mean, that's how busy some of these school nurse offices are. And so immunization work is important, but when you talk about having to constantly make phone calls to places to find records, it's a lot of labor intensive work that if we shored up systems within the community, which we've made great strides toward doing. So I feel like we are making good forward progress. We just need to do our best to make sure that everybody's willing to contribute to that work. So that we can make sure kids are vaccinated and protected. There's enough measles in this country. I don't think it's if, it's when. And we have some places within Louisville in JCPS that are not well protected. And we are at significant risk because then those kids are on buses, and we have bus depots, and we have all these things that make it a huge concern for the city. And so again, lots of great things have happened. We just need, here's where the biggest gaps are. Help getting shots in arms, help getting kids with private insurance vaccinated, and realizing still the large scale of work. We've come really far. When we very first started doing this work, we were doing entire series on kids. And, you know, Dr. Single worked a lot with this early on, and we talked about we got to dig out of the hole first, and then we'll start to be able to get to these high schools where we need a Tdap and a hepatitis A or a meningitis, as opposed to starting a whole series over and having to get that child completely caught up along the way.
So, Dr. Stone, you know, you've pointed this out, and we saw it in the data presented by Dr. Lockett. there are some opportunities with high school students.
Absolutely.
Do
yes.
you feel like that is a immunization gap or a missing documentation gap?
That I feel like is an immunization gap because they have those vaccines that are due and they don't go back. And so we, our school nurses, we have some great systems in the district. We have most of our schools use an app called Power Schools, which will let the nurses, the staff text with parents. And that is absolutely the most effective way we have found, at least for initial communication with parents. People don't want to answer phone calls. It uses up minutes on their phones, but they can get a text message and it's not going to use up their minutes. And parents can determine what language they want to receive the message in, which is also huge because we've got over 20,000 multilingual learners. And so that's very helpful in that communication, getting that message to parents. And so we're already working with communications for next year to do some additional communication. There'll be things go out this summer, reminding parents of high school students that their kids need up to date. They need their immunizations updated. The challenge with high schoolers is, we have two options for consent. They can fill it out digitally. They can fill out a paper packet, but the paper packets, once they get to high school, typically don't make it home. And we'll do mailings at times, but we don't have good success with mailings either because lots of times addresses have changed and we just don't know it. So it's not any one thing. It's a lot of things. And when we get to the point where we can say every child has access to vaccines, then maybe the district can help us be a little more like next year. We're not going to allow our academy students. We figured out this year that all those kids that have to have TB skin test, we need to, our nurses, our folks need to be checking their vaccine records before they go anywhere as well. And we're going to start saying, no, you can't do a clinical placement until your immunizations are updated. And those sorts of things that we'll just continue to work on at the high school level.
A lot of work still pending, but thank you so much for.
Yes, but we've come up, we've come so far.
Yes, and that we recognize that and we applaud that. Thank you so much because you are, working with the future of our city. So we will do the best we can, and you'll have my, like Casita Center support to approach any Spanish speaking, and also all the immigrants and refugees will reach out to those communities as well. Thank you.
We always appreciate it. We've got a great team here. I mean, they're the ones that are carrying the lift, and but there's still a lot to do.
Thank you. Anybody else? Okay. From Greater Louisville, Dr. Goldberg is traveling this morning. No actions or no action items to report from him. And Ms. Joan Reid from the Kentucky Nurses Association didn't share any statement for today. Is there any old business that we need to take care of? If not, please remember, check the two websites that Arlana will share with the board from Dr. Bryant, so we can read more about what is possible and think about the two presentations that we have today. Remember, the Louisville Metro Public Health and Wellness initiatives and priorities for 2026 year-round is reduction of hepatitis C, increased childhood immunizations, support for the reduction of lead-elevated blood levels for children, and reduction of underage tobacco sales and enforcement of the tobacco license. For the next, do we have any new business to announce? From Louisville Metro, I just want to share that today is this meeting is our last meeting using the WebEx platform for our virtual meetings. From now on, Louisville Metro Public Health and Wellness will use a Teams platform. So beware, the link will be shared with all of us. And thank you so much for taking time to participate in this month's meeting. The next meeting will be an in-person meeting or a hybrid meeting. The last meeting was a hybrid meeting as well at Louisville Metro Public Health and Wellness building. And we started that meeting at 7:30 to allow people to go back into their regular scheduled occupation. So, but there's some members of the board that to whom the 7:30 is too early. So is there any proposition to do 7:30 or 8? What would work best for you? Think about it. I'll send an email later to the board and ask, and with that we will decide. Or if we want to decide right now, we have Dr. Karam, Dr. Burns, Dr. Eccles, and that's it, to decide at what time we have to do the meeting next week. Any preference? Dr. Karam?
Oh, 7:30 or 8.
7:30, it's okay. Dr. Eccles? Dr. Burns is okay with anything. Dr. Eccles?
What day of the week?
It's May 6th. It's a Wednesday. It's for the next meeting.
Oh, yeah, 7:30. Our normal time or even earlier is fine.
Okay. So we will schedule for 7:30 a.m. So we will give time for the traveling, getting there, and the traveling going back to your regular occupations. And it will be a hybrid meeting at Louisville Metro Public Health and Wellness, 400 East Great Street. Thank you very much for being today. Go enjoy the spring flowers. Take care of your allergies before you go out. Appreciate it. Have a beautiful day.